Section 27 was established in May 2010. The name refers to Section 27 of the Constitution, which is centrally about the right to health and other key socio-economic rights. Since the beginning, we've continued to work on access to medicine, on reforming public and private health systems, on improving access to quality education. This film highlights some of the most important cases and the achievements of the last 10 years.
I'm really excited that we've reached this 10-year mark. I've been here since 2010, since we first began Section 27, and it was my job actually to go and secure the name Section 27 because it was so contentious. And we went to court and we won, and that was the first battle at Section 27. And we've continued to take challenges to court, to take challenges to the street, to go to Parliament, to improve the lives of the most vulnerable people in this country.
The reason we founded Section 27 was because we had both been leaders of the AIDS Law Project. We had demonstrated through the AIDS Law Project how effective law and litigation could be, particularly when it was combined with activism and with social mobilization and with public education.
You know, 10 years ago we were doing HIV discrimination cases, and now we're looking at really specific issues around the health system to ensure that women and girls have access to sexual and reproductive health rights and services like abortion. Now, for us, having that kind of service is really critical, but what makes the greater impact is the high impact cases.
The two cases that have been most meaningful to me was first the Michael Komape case, because as I've said before, I have a little boy that is the same age that Michael would have been had he been alive. And I think what that case did for the public, not so much jurisprudentially, was it awoke a public consciousness in people about the state of toilets and the undignified way poor learners go to school. It made people empathize with poor people that sometimes they see as just distant from their realities. It showed that dignity is important in schools.
Over yellow and black. Over uniform, all I do is work at school. Market a work in the Bonare Kivoya, like a lapalaco, we are school. Reberi put our government to Cavacalar one out of Chimatonavana. Kibona Batarola, my caravel. Libona, but Kilekaka, the donation, Kamukodi Tankaron. Namola very pretty or Bonabatarola, my caravel, Kamoka. Matomo, Lonya Kamiwisha, Raying. Nabernyaka ba phethile dilo tse ka moka kona molore re be re tlo khotsofala ebile be re ka se channel bona court ka baka la re batla ba re khotsofaditse jalo re thoma re gopela batho re tsena ke matlho a batho re gopela donation ka ge ntwe le gore e diragetse ka mo sekolong sa government.
Michael bele ngwana mongwe o lore e ke mo lebeletse e ke bona ka re ke mo file ke modimo ka e lore Michael bele motho e lore ya rata buka a rata go bala ge ke mo tshwana ngwana ka re shimo ra ithulo o rata go bala o rata go ngwala o nya go ba eng go gola a rena ke nya go ba lawyer ke nya go thusha batho.
In 2015, the Health Department terminated a contract with a private hospital, resulting in 144 mentally ill patients dying.
Section 27 first became involved in this case in November 2015, when we engaged with and then litigated against the Gauteng Department of Health, where we represented the families of deceased mental health care users over a period of 2 years. And what was amazing about that process was that we watched people go from bereaved and desperate individuals to a collective, to a group of activists who are fighting for themselves, who are fighting for their loved ones, and who are fighting for a better mental health care system. And so that was a really difficult and long and strenuous, but also inspiring and amazing case.
That case was important because the neglect of people who were suffering from a mental health condition, and people who were particularly vulnerable, were not able to speak up for themselves, who were dependent on their family, but where even the family members were unable to advocate effectively for their rights. It was an important case because of the deaths that arose from decisions that were made by government. Although there were many attempts to try to resolve it without litigation and without what ended up being the arbitration process.
And the outcome of the arbitration was an award of 1.2 million rand to each family, counselling for family members, and a plan to improve the mental health care system that needs to be reported on periodically.
Another case which had a deep impact on a broad group of people was the textbooks case, which we first brought to the court in 2012.
4 months into the academic year, yet some pupils in Limpopo are forced to share textbooks. At least 39 schools haven't received all their learning materials. The shortages prompted community-based organizations, Better Education for All and Section 27 to take the department to court.
The province was not having money. Requisitions were made. I'm not sure whether it was for the problem of the whole country, but the province was not having money in our case. The suppliers from Durban didn't supply anything. And then the issue of textbooks now started.
The department took the decision to manufacture or to produce their own textbooks, and it was a challenge. That's why it has affected the pass rate of those grades in 2012 so badly.
In 2015, the textbooks case was heard in the Supreme Court of Appeal. In his judgment, Justice Navza confirmed that textbooks are an essential component of the right to basic education.
When the pandemic started last year and everything was shut down, what happened afterwards was that government spoke about increasing the child support grant, and we thought that that would be enough to compensate for the lack of food and the lack of livelihoods. But what happened was then government suspended the rolling out of the NSNP to some of the grades that were still at home, and we immediately pursued an urgent litigation. And it was a nice collaboration between us, the Education Law Project, and our health team. And why this case is so impactful? For two reasons. When we measure impact, you look at both material impact and you also look at jurisprudential impact. From a material point of view, you could see we got a monitoring order, a structural order, and every time government was required to report, you could see that the number of learners that were being fed across the country was increasing. So you knew that this meant that learners were getting food in their tummies. The other thing is it was a fabulous case for us as lawyers from a jurisprudential point of view. It clarified that food is part of the right to education. It's also a self-standing right on its own. It clarified that where parents can't provide for children, the school, the state has to step in. It said very interesting things about the regression of rights, meaning where you provide a program and then you take provisioning for that program away. There are certain things that the state has to do and that it didn't do in this case. Historically, the courts have been very, very reluctant to give structural orders because of the separation of powers. But the more and more there is lack of accountability, the more structural orders there have been. So in that sense, the judgment was great on a jurisprudential level, but also in ensuring that learners get a meal a day in their tummies.
I think Section 27's model is a really good one. We work with affected people. That's really important to us. We are not the center of a case. We are the lawyers in the case. We are activists in our own right, but we're also lawyers, and that's the skills and the set of expertise that we're bringing. So we work on legal issues, we work in court, but a lot of the time we're not in court. A lot of the time we are working with communities on things like rights education so that people know what they're entitled to and what steps they can take to realize their rights or to ensure their rights are realized. We work with the media so that people across the country know what's happening, and it increases the pressure to make the change that needs to be made. We work with people through mobilization so that people are demanding their own rights. And we do a lot of in-depth research so that everything that we do, whether it's in the court or out of it, is backed up by evidence and thorough academic research. So we know exactly what the budget is, we know exactly what's been spent, we know what the international law on a particular case is. And I think taking this very thorough kind of multi-pronged approach means that we can be successful in the issues we take forward and the rights that we're seeking to have realized.
Our particular role was to focus on the communities that were affected and to bring that perspective to the case. The communities, and these are the communities that are in the further reaches of the country, where, you know, at a certain point in a miner's life, you go back to be ill from silicosis and die.
As TAC and Songe Gender Justice with Section 27 and other activists who supported us, we declared that this is a battle between David and Goliath. We regard ourselves as Davids and these big bosses, these big companies as Goliath. So as civil society, as people of South Africa, we are using the constitution and the justice system as the sling and the stone to defeat this Goliath. So it means victory to the people of South Africa.
Not only was Section 27 able to secure victory for rural communities in the silicosis case, but also for the communities of Xhochamouth and Village Clinic in the mostly rural province of the Eastern Cape. The community at Xhochamouth laid a complaint against the Eastern Cape Department of Health in 2013. Following ongoing advocacy from the clinic and ambulance committee with Section 27 support, the department stationed an ambulance in Xhochamouth for the first time in 2016, but it was later removed. We continue to work with this community and others across the province to ensure access to emergency services.
The case of Village Clinic in Lusikisiki in the Eastern Cape, which was one of the first things I worked on at Section 27. And that was where there was a clinic that had been operating in a building for 40 years. And the Department of Health in the Eastern Cape decided that they didn't want to pay 8,000 Rand a month in rent, and they moved the clinic from this building into a field where they eventually put a tent. And it meant that people were standing outside in the cold and the hot and the rain, having to explain their medical issues, and the department was just refusing to do anything about it. And so working with the TAC, we intervened, and eventually through an out-of-court settlement, a new clinic was planned and eventually built.
Section 27 represented the learners in the school governing body of Makangwane Secondary School in Limpopo, in a school infrastructure case where children were learning under trees. As a result of our intervention, the matric class of 2019 was able to write their exams in mobile classrooms, and the school received a 100% pass rate. Section 27 defended community healthcare workers in the Free State who were arrested and charged with attending a gathering for which there was no prior warning, in contravention of the Regulation of Gatherings Act 205 of 1993. The matter was taken on appeal to the Free State Division of the High Court, where the court found that attending a gathering for which no notice had been given did not constitute a prohibited gathering in terms of the Act. They were able to get the conviction overturned and their record cleared. Although Section 27 has succeeded in achieving justice for individual families and communities in the last 10 years, the work must continue.
I think broadly civil society has a really important role, and the COVID crisis has shown us where civil society is needed. You know, what's happened during COVID is there's been a real exclusion of anyone who isn't government or in some cases business. And the result of that has been that people have been left out of decision making. People are hesitant about vaccines. People don't have the kind of information that they need because they're not brought into government's confidence. They're not allowed to co-create plans for rolling out of a vaccine or even social behavior change. And so I think civil society needs to be seen as one of the important arms within society to be influencing business and labor and government to create the kind of change that is needed and that suits people, and that indeed ensures the realization of rights.